Good afternoon. I'm Adriana McIntyre, Assistant Professor of Health Policy and Politics at the Harvard T.H. Chan School of Public Health. Joining me today is Roy Cooper, former governor of North Carolina and current Richard L. and Ronay A. Menschel Senior Leadership Fellow here at the Chan School. Governor Cooper, thank you for joining me.
Glad to be here.
Before we dig into your experiences in North Carolina, I wanted to give you a moment to talk about why you chose to spend this time here at the Chan School as a Menschel Fellow. What is it that you've gained from your time here, and what do you hope to leave the students with?
My mission as governor was to make sure we had a North Carolina where people are healthier, better educated, with more money in their pockets so they can live more prosperous lives. I ran across so many public health officials who worked so hard every single day and pursued their careers with such passion. I wasn't governor very long before I had to deal with Gen X, a PFAS, a forever chemical down in Wilmington. Obviously, we had COVID. We had Medicaid expansion that we had to work on. We worked on medical debt, and the public health community was with me every step of the way, and I just enjoyed them. So coming to the school, being in this class, meeting with the future leaders of public health, not only in North Carolina and in the United States, but across the world here at Harvard Chan School, it's been wonderful. And it's been great to ditch the tie. This is the first time I've worn the tie since I've been here. So that's been a lot of fun.
This is the first time I've worn a suit in a long time.
I love it. So thanks.
So while you were governor, North Carolina successfully expanded Medicaid to cover an additional 650,000 residents. And let's start with a little bit of background for what made that possible. The Affordable Care Act extended Medicaid coverage to all households with incomes below a specific income threshold. But the Supreme Court left the option to the states of whether to actually expand that coverage or not. And there are typically three paths that states can take to expand their Medicaid programs. Most commonly, state legislatures pass bills that governors sign into law. In rarer cases, the governor might be able to take unilateral executive action. And when the legislature and governor are unable or unwilling to pass Medicaid expansion, some states have turned to ballot initiatives where citizens have passed Medicaid expansion on a popular vote. In fact, the 7 state expansions that preceded North Carolina's all used those citizen-led ballot initiatives, generally in Republican-led states. But that wasn't an option in your state. So tell me about how Medicaid expansion unfolded in North Carolina.
Well, when I became governor, I believed that the best way to expand health coverage and to make North Carolina healthier, which was part of my mission, was to expand Medicaid. We only had one option because our Constitution didn't allow us to do a ballot initiative. And before I got elected, the Republican governor signed a bill by the Republican legislature giving them the sole authority to expand Medicaid. So I knew when I went into the office, I had to try to convince a supermajority Republican legislature to expand Medicaid. Now remember, there was a lot of political opposition because it was deemed as part of Obamacare. Mm-hmm. And so when I went into office, in fact, when I started working on some executive work to get us ready to pass a bill, they sued me in federal court and got an injunction. So we spent years working to try and convince the legislature that this was important. We brought people who fell in that gap between regular Medicaid and between being able to get subsidies under the Affordable Care Act in the marketplace. People who are working, most of these were working North Carolinians, but that didn't work.
Right.
So we elected enough Democrats to uphold my veto, so I vetoed the budget because it didn't have Medicaid expansion in it. And we fought back and forth for years and brought medical providers to come and talk with them, and that didn't work. Finally, over the last few years of my administration, we worked very hard to have constituents in these Republican legislatures, in these districts where they elected Republican legislators, to tell them how important Medicaid was. You mentioned earlier about red states passing ballot initiatives. People were for this.
Yeah.
So we were able, with a group of people and a few Republicans in the legislature who believed that this was the right thing to do, we were able to form groups that worked with Republican county commissioners who told their legislators, look, our rural hospitals are close to closing. Several of them already have. We need your help. We had Republican, tough on crime Republican sheriffs who saw so many people that they had to deal with mental illness, with substance use disorder. One of them told me, a lot of them in my jail, they need health care. They don't need handcuffs.
Yeah.
And so we got the Sheriff's Association and the Police Chiefs Association to tell these legislators that we needed to pass Medicaid expansion. Business owners who understood that their private health insurance, when a hospital or a medical provider has to treat an uninsured person, generally the way they make it up is to first go to the private sector. So they recognized that, one, Medicaid expansion could help make their workforce healthier, but also it could help to suppress their health care premiums. We had insurance companies, obviously, who were going to make money on this. We had doctors and hospitals. Finally pushed the Republican leadership in the legislature to say, okay, we need to expand Medicaid. That was great. It was a wonderful day, but that wasn't the end of the story. Because even with agreement to expand Medicaid, there were a number of legislators who wanted trade-offs. Like they wanted changes in North Carolina's Certificate of Need law, which many of them viewed as anti-competitive. They wanted it taken off. Well, the hospitals who were for us on Medicaid expansion were staunchly opposed to changing Certificate of Need. So we spent a lot of time working on that because we had multilateral negotiations going on. I had all of the hospital executives over to the governor's mansion, and I said, we have to find a way to get compromise on Certificate of Need in order to get the Republican leadership to agree to Medicaid expansion. So we finally did. I said, we're going to bring in lunch. We're not leaving until we get this done. And we did. We got an offer on the table. It was hashed out over a period of days. They had also said, okay, Medicaid expansion has to be in the budget. Well, there were a lot of bad things in that budget. So we had to work around some of that. And at the very end, when I thought that maybe all was lost, which probably happened 100 times during the years that we tried to get this done, one of the main Republican leaders was trying to attach opening casinos in North Carolina to the budget. Well, that caused a lot of the Democrats to rebel. It caused a number of the conservative Republican caucus to rebel. Finally, he relented. We got Medicaid expansion in North Carolina. Now, 652,000 people have Medicaid coverage, and we're hoping that with all that's happening at the federal level, that we can maintain that for the people of our state, because it's already made a real difference in the lives of people. I've talked to so many of them. It's been an amazing thing. 10 more states need to do this.
And do you think that this is a template that other states can use?
Already we've had people ask us how we did this. And you know, there was a lot of political tension. In fact, there are times when I had to lay low because there were some Republicans in the legislature who didn't want to give me a win on Medicaid expansion. So we worked it out where we had voices everywhere supporting this and letting them know that it was critically important for us to get this done. And finally, we were able to make it happen.
What are the key challenges you think that other states are going to experience? What lessons should they draw from your experience and the amount of time it took you between, getting into office and finally getting that bill signed?
You know, it's important for so many others to be speaking besides the politicians who are for this. It's important for doctors and nurses to be speaking. It's important for law enforcement and business people. It's important for rural America. many of the legislators who oppose Medicaid expansion have constituents who would be helped the most. In North Carolina, we saw rural counties benefit the most because there were people there, hard-working people, many of them who had 2 or 3 jobs. Many of them worked for small businesses who couldn't afford to buy insurance for them, who now have coverage. One of the things we did was an interactive map where you could go to a county and you could tell how many more people would have health insurance, how much money was going to come into your county, how many jobs were going to be created, because you're going to create more medical providers, particularly in behavioral health, which was really exciting for us. So all of these things coming together was really an overwhelming push for a Republican leadership that admits, and I thank them for saying, okay, it's time to do it. Now, what they would tell you is that I don't know how long this is going to last, and I don't want us holding the bag here. But what we were able to do with this is do 10% that is required for the states to pay, the hospitals pay it. So one thing that we could continue to say, and these 10 states can say, it's going to cost you $0 in additional state tax dollars to do this. And I would say, why is North Carolina turning away $521 million a month? A month in tax money that we've already paid to Washington that's going all over the country.
Right.
Why are we not taking advantage of that when all we have to do is say one word? Yes, we'll take the $521 million a month to help our people. Finally, that logic prevailed. Took too long.
So you mentioned this at the top. You had also focused on reducing medical debt, and North Carolina's relieved some $4 billion in medical debt for almost 2 million people. Tell us about why you made reducing medical debt a political priority.
Yeah. So when I gave my best day as governor, December the 1st, I've told many of you this, I gave Penny the first Medicaid expansion health care card. Tears in her eyes, tears in mine. I saw so many adults that day getting medical insurance, many of them for the first time. And let me tell you one more thing why I love public health people. I've told people this. The public health people are over there happy for the day, but thinking about, hey, in our free clinic now, we're going to be able to get some compensation for treating people that have been uninsured. We can go find more uninsured people to help, because there's still 900,000 people in North Carolina who still don't have health insurance. One of the reasons I love public health people, thank you very much, because you're thinking ahead and thinking about how you can help people. But what we found, people were so happy to have their insurance, but they owed thousands, hundreds of thousands of dollars in judgments that had been recorded against them, which prohibited them from getting credit cards, buying a home. Many of them with meager salaries were carving out $80 a month, paying a $180,000 bill, and they would never, ever pay it. So we said, let's figure out a way to try to help them. Well, there are healthcare access dollars that are direct payments to hospitals that the federal government has in place, and it came with the American Rescue Plan that helped hospitals recover. So the bottom line is, and I don't know how far along we are on time, but the bottom line is what we wanted to do was condition those payments on getting hospitals to relieve medical debt for those who are poor and into the middle class as well. As you can imagine, it was very difficult. We had 99 hospitals in North Carolina. We started this effort after Medicaid expansion. We went to the hospitals and said, we'd like for you guys, in exchange for this direct payment money, to forgive this medical debt. That was not greeted warmly. There was concern about conditioning this money, nose under the camel's tent. Campbell's nose under the tent, that type of thing that we continue to hear. So what we did was we worked with them on it, but then the Hospital Association, as we were about to announce this, came out against it. So all 99 hospitals then essentially turned on us, even though we were still back channeling several of them. We ended up calling a press conference. My Secretary of Health and Human Services, who really did all of the groundwork, not all of it, but much of the groundwork on this, we held a press conference, invited all of the hospitals to come. None of them came. We said this program is going to be in place, and what we decided to do, instead of forcing them for all of the money, we tiered the money. We said, you're going to get this much if you do nothing. You're going to get this much if you enter into this medical debt program, which would forgive all of the medical debt for Medicaid enrollees, for people making less than 350% of the federal poverty level. It's pretty complicated, but it was a way where you can automatically enroll people into this. One by one, the hospitals agreed to do this because they really weren't making any money on this medical debt. They'd already written it off a couple of years ago, and the percentage of money they were making and the goodwill that they were buying, they should have come to the first press conference, on doing this was pretty significant. So North Carolina has now wiped, well, is in the process of it, but it's already starting, $4 billion in medical debt for 2 million North Carolinians off the book, plus a program going forward that we have nonprofits that have been working in this field for a while who are sort of marshaling this. They were already setting up their systems that already automatically enroll people in charity care, and many of them had these programs already in place. They just didn't tell people about them.
Right.
So people had to know about them in order to enroll and apply into. Now they're going to automatically be enrolled. We've had a lot of states who've said, let us know how you did that as well, because I think getting rid of medical debt is critical for the health and well-being of people across this country.
So you mentioned that state-directed payments are what made that program possible, and you've
That's
also
right.
alluded to hospital taxes or provider taxes that lots of states,
Right.
most states, use to help finance their Medicaid programs. Those funding sources are currently potentially under threat as Congress thinks through ways to rein in Medicaid spending. What might the impact of cuts like that be for North Carolina and for other states?
Well, first thing is that the president has said time and time and time and time again that we're not going to touch Social Security, Medicare, Medicaid. So that's something that we should continue to talk about as Congress considers these alternatives. The president said he's not going to touch them. We know that with the legislation that they've passed requiring hundreds of billions of dollars in cuts, that it's impossible to make those cuts without touching some of that. So already people have been looking what might happen. These direct payments to hospitals are one that people think they may go after. And look, hospitals use this money well, and particularly when we've conditioned it on a program. But here's what I believe about what we've set up. I think that even without the payments, that the programs are already in place. The goodwill is there. It doesn't cost them a lot of money. They would have to go back and reprogram everything. We believe that a lot of what we have set up will remain for charity care, and hopefully we can find another way to incentivize it. Hopefully all the money won't go away. Maybe the payments would be reduced. So I'm hoping that's the case. And as for the provider tax, it was important to encourage states to do this, that they were able to leverage this so it wouldn't cost any state tax dollars, particularly for these last few states who don't want to do it. Mm-hmm. If you have a state price tag on it, that's going to make them less likely to do it. So I'm hoping that we can find a way. There's also insurance companies that could be a part, because they're, particularly with most states having managed care with Medicaid now, there's a way, they're making money off this too. Mm-hmm. There's a way to structure it so that states can continue to rely on not having to put money in this, because not only do we want people to keep it, we want to encourage these other 10 states to do it.
So stepping back from Medicaid specifically and sort of thinking bigger picture, it seems like our communities and our conversations are increasingly siloed. I often hear from students that it feels like they don't know how to begin to work productively with others that they disagree with on topics that they consider polarizing. What did you learn about de-escalating polarization and working across party and ideological differences through your bipartisan work on Medicaid?
My dad and my preacher always told me that when you are talking with people that you do disagree with, to try to imagine being in that person's shoes. Imagine what that person is reading, hearing, what their fears and concerns are, what their motivations might be, although I don't like to assume people's motivations. But I think going into a conversation with having thought about that understanding gives you more room to try and find common ground. You know, we have issues with vaccinations. I've got my wonderful wife, Kristen, who's here. She and I have talked about immunization strategies before, and it's important to gain confidence with people. Everybody wants their children to be healthy and safe and not to get diseases. And you can start off with common ground things and then begin to expand out. And the good thing about public health officials is that there's already a level of public trust there. Mm-hmm. Yes, there's been a lot of disinformation. Yes, the trust has gone down in polls because a lot of people have believed this disinformation. And it's important for health officials to recognize, though, that they still have this aura about them that's positive with most people. I told people in North Carolina that nurses ranked the highest in North Carolina is who people trust. And so trusted voices in communities, listen to them, let them tell your story. We can do this, but remember too that you have a core set of values that you don't want to cross that line, and sometimes you just have to fight. Sometimes you just have to make a decision. We're going to disagree with this, and whether it's in the political arena or whether it's in the halls of Congress or the state legislature, we're going to disagree on this issue, and we're going to try to win it. We're always ready to talk. We're always ready to find a consensus to move forward, but we're going to try to get more votes than you on this issue. And that's what we're going to have to do a lot these days, and people are going to have to get engaged in government and politics, as distasteful as that may be for people. At the end of the day, that's how things are going to change, and at the end of the day, that's how people own our democracy.
Yeah. On Trusted Voices, my doctoral advisor, Robert Blendon, used to say, you can't go wrong with nurses, doctors, or firefighters.
There you go. Those rank very highly, that's for sure.
With so much uncertainty about the future of government investment in public health, what is your advice to graduates of the Chan School looking to begin or continue their careers in public service?
Yeah. Congratulations to all of the students here. I mean, just being admitted to the Harvard Chan School of Public Health is an extraordinary achievement. I've met with a lot of students during my office hours individually. I've got some class members here. Thank you guys for coming who have been in my class. I'm so grateful for their willingness to use their strong minds and to engage in public health, because, I mean, we all know that in most instances it's not the highest paying job, and particularly with the smart people who are here, you probably could do some other things to make more money. But pursue your passion. Pursue your passion. And remember that even with turmoil at the federal level, most of the work of public health occurs at the local and state level. Most of the innovation, most of the on-the-ground work happens there. And I also know that there's a lot of uncertainty about the job market. And some of you have been offered fellowships or internships or even jobs that have poof, disappeared because of what's happened in Washington. That's got to be nerve-wracking. You don't know what to do next. But remember, there are things out there for you to do. Maybe change your focus on something state or local that can be positive, or even private sector, and then move into the public sector in some way. Because there's a lot of places where your help is needed desperately.
I think we've got a couple more minutes before we have to wrap up. Is there anything I didn't ask you? Anything you'd want to share that I haven't prompted you to share?
Well, I'm just grateful for this chance to be in this environment and to be at Harvard at this period of time. I'm proud of what the administration has done to stand up and to work to protect academic and scientific freedom. So much research goes on here that has helped cure diseases, that has helped people all across this country in so many ways. And I think it's critical that we preserve it, and if you don't stand up and fight for it, then it can dissipate quickly. So I'm excited about that, and excited to get an opportunity to be here and be a part of it. I told someone that the only teaching experience I'd ever had was 2.5 decades of teaching Sunday school. And at the end of that hour, I was always exhausted. So I didn't know, that made me appreciate public school teachers. My mom, by the way, was the greatest public school teacher in the history of North Carolina, just so you know. But it was a bit of a challenge to come and teach a graduate school class, School of Public Health in Harvard. It may have been the most impressive thing that I've done, that Kristen says, maybe. no. But it has been a wonderful experience, and I've been grateful for it. Thanks.
Thank you. And thank you all so much for being here today. If you missed any part of the discussion or want to rewatch it, a recording will be posted on the Harvard T.H. Chan School YouTube page. Have a great afternoon.